Hi, my name is Ashley Mills. I am currently a student at Mount Mercy University in the MSN program. Today we're going to talk about behavioral learning objectives for hemodynamics in the cath lab. Many new staff members in the cath lab, whether they are a nurse, paramedic, or radiology technologist, have minimal knowledge regarding hemodynamics. In the cath lab, while a staff member is filling the monitor role, they must be able to interpret the hemodynamics on the monitor. These hemodynamics include the blood pressure, heart rate, cardiac rhythm, pulse oximetry, and end tidal CO2. Staff members need to be able to quickly recognize changes in these hemodynamics and alert staff in the room so they can begin treating these changes as required. Understanding hemodynamics is essential for understanding physiology and pathophysiology of your patient's condition. Cath lab nurses, paramedics, and radiology technologists need to enhance their proficiency in interpreting and responding to hemodynamic changes during interventional procedures to improve patient safety and procedural outcomes. Next, we're going to talk about the characteristics of learners. Educational background can have an impact on how well one understands hemodynamics. Nurses with an associate's degree in nursing may not have as much experience with hemodynamics as those with a bachelor's degree in nursing. Radiology technologists receive less exposure to hemodynamics during their training compared to nurses and paramedics. So much of what they know is learned on the job. The knowledge base encompasses ACLS protocols, critical care concepts, critical thinking skills, clinical judgment, and the in-depth knowledge of interventional cardiology and hemodynamics. Another characteristic of learners that must be considered is the learner's preference. Whether they are a visual learner, auditory learner, hands-on learner in real time, or another type of learner. Seeing a monitor that looks like this to a new staff member can be intimidating. A learner will be able to look at this monitor after this course and be able to interpret what each waveform, number, and button on this means on this screen. Learning objectives are used to create a clear roadmap for the learner, ensuring a focused and practical learning experience. These objectives are to clarify what the learner should know once the course is complete. The learning objectives for this course are: the learner will be able to state normal parameters for the following hemodynamics: blood pressure, heart rate, pulse oximetry, and end tidal CO2. The learner will be able to list interventions when one or more of the above hemodynamics are outside of the normal range. The learner will be able to recognize normal sinus rhythm, ventricular fibrillation, atrial fibrillation, and complete heart block. The learner will be able to state treatment for ventricular fibrillation, atrial fibrillation, and complete heart block. A right heart catheterization is another form of hemodynamics that one must be able to interpret while filling the monitor role in the cath lab. Learning objectives regarding a right heart catheterization include: the learner will be able to interpret the different waveforms based on where the Swan-Ganz catheter is in the heart. The learner will be able to state normal pressures during a right heart catheterization. The learner will be able to list diagnoses associated with a right heart cath and the pressures that are outside of normal range. A learner will be able to state treatment options for the right heart cath pressures that are outside of the normal range. Staff understanding and being able to respond to hemodynamic changes in the cath lab are crucial for accurate diagnosis, appropriate interventions, safe patient care, and guiding treatment for patients. Successful management of hemodynamics in the cath lab relies on advanced preparation, prevention, anticipation, awareness, and teamwork. If staff can be competent in these items, they can create a much safer environment for our patients, build teamwork, and gain trust from their coworkers. Learning and improvement are essential in the management of adverse events of hemodynamics. Successful management of hemodynamics is a team-based effort.